My name is Patrick Schumann, and today I'm going to be demonstrating a primary IV line. So the doctor's orders are for 500 milligrams of vancomycin. Vancomycin is an antibacterial. The side effects are ototoxicity, nephrotoxicity, nausea, vomiting, and phlebitis. The contraindications are renal impairment, and the implications are Redman syndrome, and I need to check the culture and sensitivity before administration. So the doctor ordered 500 milligrams, and my vial is 250 milligrams per milliliter. Therefore, I'll be drawing up 2 milliliters. So first I need to use my antisepsis technique and clean the top. And I would then pull out draw back 2 milliliters. Then I would pull back 2 milliliters. I would then grab my medication bag. And before administering, I would clean the port. After that, I would administer the medication. And I would dispose of this into a sharps container. After getting medication, I would lightly shake it, and then I would apply my label. On my label, I would write my initials, the date and the time, the medication, and the patient. After that, I would hang it. And next, I would get a new needle, and I would drop 6 milliliters of saline. So I would clean my port to my saline. And I would draw back 2 milliliters. I would then dispose of the needle in a sharps container. And now I am ready to go into the patient's room. So I would enter the patient's room. If I haven't already, I would identify myself and ask for 2 identifiers, name tag, their name and their date of birth. And then I would hand hygiene and apply my gloves. After applying my gloves, I would then check the integrity of my package and the expiration date. And once that was verified, I would take it out. I would then be able to attach it to my medication bag. So I would clean the port. After attaching, I would prime the line about halfway, and then I would label the tubing, my name, date, initial, time. After doing that, I could administer normal saline. I would first have to clean the port. I would also check the insertion site for any tenderness, swelling, or redness, and then I would be able to inject my saline. I'm going to inject 3 milliliters after I aspirate using the push-pause method, 0.5 milliliters at a time. After that is complete, I'm ready to administer the medication. So I would unclamp the line. And prime the line. After that's primed, I would clamp it again. I would next clean my port. Again, just making sure that the site is intact. And I would attach it. After attaching the line, I would unclamp the line and then establish my drip factor, which is 6 drops per minute. So I actually need that again. After establishing my site, I would check the 4 Ps before I were to leave, and again check the site. And then I would leave and shortly return after the bag is finished. So when I came back, I would perform hand hygiene and put on my gloves again. I would again identify the patient and identify myself and let them know the procedure. In the beginning, I also let them know that vancomycin is antibacterial. Now that the medication is done, I would clamp the line. I would also clamp this line, and I would be able to I would then flush with 3 milliliters of normal saline. I would clean my port. I would check the site again just to make sure while I'm doing so. I would use the push-pause method still, using 0.5 milliliter each time. After that is complete, I could then undo that and clamp the line again. Now that the procedure is over, I would document using my date, time, and initials, and I would also close the bag. After everything's done, I would document my name, date, procedure, place, drug, how the patient took it, what arm it was in, and even after doing that, if it was a central or a PIC, I would have to follow with heparin after the saline. And I would also just check the route and the fluid used and the intake and output.